and welcome to Research Bites, your daily dose of science news. In the past few months, the world has been taken aback by measles outbreaks in countries like France, New Zealand, and the United States that were once thought to be measles-free. Experts partly blame the growing anti-vax movement that has ill-informed parents refusing to vaccinate their kids, fearing unintended consequences like autism, which are wrongly associated with the measles vaccine. In this atmosphere of fear, science has a different story to tell. Vaccine complacency or anti-vaxxers are trying to scare people. Pair that with irresponsible social media usage, and you have your major culprits. In a recent study that was published in the journal eLife, researchers analyzed the impact of the national measles immunization campaign in India. Measles is a highly infectious and potentially fatal disease that is caused by the virus Measles morbillivirus. Its symptoms include a fever, runny nose, and red eyes with rashes that appear all over the body. Since it spreads through the air or by direct contact, 9 out of 10 unimmunized people in a room can contract the disease from an infected person, and young children that are below the age of 5 are at the highest risk. More than a third of all measles deaths in the world are among children in India, and the government has launched widespread immunization campaigns in 2005 to tackle this. Routine vaccination through schemes by the Integrated Child Development Services and the Ministry of Health and Family Welfare are passive and rely on families to show up at the health clinics. The 2005 campaign strengthened routine vaccination, but most importantly, it adopted special days on which teams went out to find eligible kids who had been given 2 doses earlier. This is an active method. The researchers analyzed the impact of this campaign by studying 27,000 cases of measles across the country and carrying out a statistical analysis on them. They found a significant decrease in the number of measles-related deaths among infants after the launch of the campaign. About 41,000 to 56,000 measles deaths had been averted between 2010 and 2013 in children under the age of 5. The average annual rate of reduction in measles rose from 12% before the campaign to 22% overall in India. This success can be attributed to campaigning in the targeted states of Madhya Pradesh, Uttar Pradesh, Rajasthan, Chhattisgarh, and Gujarat. So, how far are we from eradicating the disease in India? Well, measles deaths might have been eliminated, but not measles cases. To get rid of a disease, we'd need very high levels of coverage so that any infected individual would be unable to spread it to anyone else because they would have been vaccinated. We need both intervention and monitoring to wipe out this disease, just like India did with polio. The results of this study are a testament not only to how well vaccines work against measles, but also to the importance of active vaccination schemes that make vaccines more accessible to the public and spread awareness. The increasing propaganda against science can be potentially life-threatening, but studies like this one highlight how irreplaceable vaccines are in modern society. Thank you for listening. Don't forget to like, share, and follow. This podcast was brought to you by Research Matters, a SciComm initiative by Gubi Labs. For more science-based stories, podcasts, and news, log on to our website www.researchmatters.in.